Hello, I will be going over on how to properly assess a student in the Brigance Diagnostic Comprehensive Inventory of Basic Skills, the revised edition. Now, the first thing we need is a teacher guidebook, which you see in front of you. The next thing you need is obviously a student record book. In this section of the book, the student will record their findings. Now, the program emphasizes individualized instruction. Number 2 and 3 is the purpose and the features. Now the purpose of this exam is assessments to identify. Next, diagnostic instruments. And 3, recording and tracking the system. And features. This test is comprehensive. Its criterion reference is text reference and has been validated by the Los Angeles Unified School District and Common Core standards. Now, the general directions on how to assess begin with identifying skill area to be assessed. Next, identify the most appropriate skill level within the sequence for initiating the assessment. Third, select the best assessment method. Fourth, organize your materials. Obviously, we have just spoken about the materials. Number 5, follow the assessment procedures. One of the important things in special education is to adapt if appropriate. Give more time, allow the child to move if necessary to a quieter area or to a place where you will not be disturbed. Number 6, test down or test up in a skill sequence according to the student's response. If the student does not respond to an item or the response is incorrect, test down by going to a lower level. If it becomes obvious that items are much too easy, test up by skipping to higher level items. And last, record the assessment data. As we obtain information regarding the skill the student has mastered, record it in the student record book. Record observations and make diagnostic notes as appropriate. Now, the final thing on our assessment and how to administer is the do's and don'ts of this test. Only select skill sequence that we believe will be the most likely to yield helpful information. Follow standardized administration procedures in order to obtain valid norm scores. Strive to initiate an assessment at a level in the skill sequence that will promote a feeling of success for the student. In special education, we promote success. Identify skills in a skill sequence that are not administered because they are too easy. Give examples. Demonstrate is important as well. Rephrase verbal directions, not only once, but twice, maybe even 3 times, according to the child's needs. Give credit for skills that you know the student can perform well. Again, we promote this as positive reinforcement. If performance is mastery of a skill is considered, then we keep moving. More practice might be needed for functional mastery. And the next thing we're going to talk about is things we do not do during the assessment of the test or the recording of the record book. Never plan to use all assessments with the student. Do not assume the assessment procedure have to be adhered rigidly in order to be used effectively. Don't initiate or continue the assessment at a level that frustrates the student. If a student becomes frustrated, they will not continue or will walk away. Do not waste time assessing skills that are far below the student's performance or skill level. Don't coach, but be prepared to rephrase. Don't ignore other available resources of student data. Don't assume that the student will apply or perform a skill in a functional manner in his or her environment just because mastery of the skill is demonstrated during the assessment. Don't give credit for a skill if mastery is at the emerging or marginal level. Don't give credit if mastery is questionable. We must be sure that these things are done correctly and appropriately in order to get a correct score while assessing a student in the Brigance Diagnostic Comprehensive Inventory of Basic Skills. Thank you very much. Hope you enjoyed it.